In the emergency department, I see a lot of folks on the worst day of their life. There's a massive difference between healthcare in Australia versus healthcare in America. People in America have an aversion to interacting with the healthcare system because they're worried about the cost. Even if you have the best insurance in the world, if you go to the emergency department, there's going to be some sort of a copay. It's just very challenging for folks. Diet, exercise, social connection. Those are the three things that I see people skipping over the most when they come to me in the emergency department. If we want this country to have better outcomes, we do need to think about spending our money before disease risk presents. As a society, we need to encourage people to...
Dr. Cois, welcome.
Thanks so much for having me.
Thanks for coming. I'm super excited for this conversation today. You have a really interesting background as a professor of emergency medicine, emergency room physician. How did you get interested in longevity?
Well, it's a massive question. I unfortunately get to see a lot of folks in the emergency department who come in on the worst day of their life. Some of them are unfortunately dying. Some of them are having complications of like chronic diseases, which are going to cause them not only mortality and death, but morbidity. So their life will never be the same. They'll never be able to like exercise as much as they used to, or do simple things like get up off the floor, off the chair at home, in a safe way. And I think some of the things that kept sort of coming back to me is that a lot of these folks are living with diseases that are preventable. It's very well known that vast majority of like cardiovascular disease is preventable. And I'm starting to see people who come in who are younger and younger, and just makes me passionate about wanting to try and head that off so that I don't have to see them on the worst day of their life in the emergency department.
Well, that's noble work for sure. Just to talk a little bit about that experience, are you still practicing actively? Are you still in the emergency department?
Yeah, that's my full-time job. Yeah, I'm there.
One of my best friends is an acute care surgeon. She is an incredibly strong human being, and I marvel at her ability to, in a sense, compartmentalize, or, maybe a better, healthier way of saying it is, she has this incredible ability to reframe, just all the trauma that she sees, the worst imaginable stuff, which I know you see every day as well. How do you think about that? How do you go home at night? It's incredible to me.
It's a good question. Actually, I was just talking to a colleague about this the other day. I'm like, are we going to at some point down the line just like wake up screaming in the middle of the night at home because of all the trauma that we've seen? What I will say about that is that I feel very fortunate because we get to work as a part of a high performance team. So, and that team includes like myself as a physician. Oftentimes I'm working with another physician, and if I've got a really challenging case, I'll bring them in, and you get to work with a colleague as well to try and figure out what's going on. We have a team of nurses, we have emergency room techs, we have X-ray folks, we have radiologists that are off-site, we have cardiologists as well that we can call and get support. So you're not in there by yourself. You're there with a team. And although as a team we deal with trauma, we talk about it pretty openly. I think we're kind of, in a way, we probably all have a little bit of a screw loose to want to do this work. But my take on it is that I have challenging cases. And when I do get a challenging case, it makes me want to do better and be better for the next time that I get a challenging case, so that I can potentially help that person, even if I don't, completely reverse what they've got going on, but just do better than I did the last time. Certainly it helps me personally to like get through that trauma. But it also, I think, helps the person that is going to come in front of me.
How much mentoring goes on?
Oh, a ton of mentoring. Yeah. I mean, I feel like my role in the department is, I see myself as like, when I'm there, I'm a leader in the department, and that extends to like, how are we moving patients through the department? Are we like, can we move people to different areas so we can free up acute care beds? Can we like think about like how many ambulances are coming in? As a leader in that role, I like to push that towards being a mentor for other people as well. So, like the other day we had a trainee, a nurse who had just started, and this was her first nursing job in the emergency department. And it was the first resuscitation. We unfortunately didn't get the patient back and they died. And, she was beside herself. I think her role was, she was maybe like the scribe or something like that, detailing the doctor, what was going on. And like just sort of exploring that with her was really interesting. For me, it was really interesting, even though she wasn't supporting me or no one was supporting me necessarily. Helping to support other people was really helpful for me, because it kind of like gives you a chance to like run through what happened and see, again, what you can do better the next time. And then acknowledging what you did really well. It comes down to the training that you have and, how you can do things better. I mean, I love talking about teams, because before I went into medicine, I was sports performance coach. And I worked with a lot of teams and was a strength and conditioning coach. So like, I love that team mentality, and that doesn't all come down to one person. Sure, you may have like let in a goal or something like that, but like there were so many pieces before that your team members could have made different actions and prevented that from happening. So I apply the same thing to the work I do in medicine.
That's a whole nother podcast, just in terms of talking about high performance in healthcare, because I think I think there's starting to be more energy around this idea, or more acknowledgement that, hey, why don't frontline healthcare clinicians get the same tools as professional athletes and elite military operators? Like, it's kind of crazy, right? When we think about the lack of education and training on how to, regulate the autonomic nervous system, for example, and how to regulate, emotions and, and how those entry points are actually through the physiology, in part, our psychological framing and all of that, but just, simple things on, when and how to eat and, just stuff that athletes get access to. Yes, I feel really passionately that frontline medicine should get access to the same tools.
I will say on that point, I think that we are getting better, but it's baby steps. I think the biggest piece is that we're acknowledging more and more that we have really hard jobs. And that people rely on us, the patients rely on us to be there and be ready to perform. There has been like a big shift, I guess, that I noticed during my training in particular, and I'm practicing in a part of the country that is like values, the wellness of its employees.
What part of the country are you?
I'm in Northwest, so I'm in Portland, Oregon. Obviously, culture is something that takes a long time to change, but we're working hard to like acknowledge that people have lives outside of medicine, and that we are trying our best to honor that people, are not doctors or surgeons 24 hours a day, and it's important to, help people so that they can come to work ready and, not suffer the consequences of having overtaxing work, when they leave work.
So you just delivered a TED Talk.
Yeah.
Literally just moments ago. and we're here in Whoop HQ. Tell us a little bit about the subject of your talk and why you chose that.
It was titled, Why Australians Live 7 Years Longer Than America.
It's very provocative.
Yeah. Well, when you read about how to give a TED Talk, they say, start with something provocative.
I know.
So I thought, why not? I thought I'd just throw myself in the lion's den. But when I first started residency training in the US, because I did obstetrics beforehand. So I worked for 5 years after my, medical schooling back in Australia. I haven't run into too many docs that are practicing in America that have taken my pathway, because we have a really functioning healthcare system in Australia. And oftentimes, like, I'd have some of my mentors and teachers while I was doing my emergency medicine training in America say, why would you leave? And of course I left for reasons that were not related to medicine. I left for love. My wife is American, so we moved over here so the kids could be closer to grandparents. So it got me thinking, and I was sort of chatting with organizers about this, and, why is it that Australians, who ostensibly are very similar to Americans, we love the same things. We love sport. I grew up with when Michael Jordan and the Chicago Bulls were like the hottest ticket in culture, so, and we did everything. Like, kids would be walking around like wearing basketball, NBA gear. And so we love American culture, and we do a lot of the similar things. And I talked about some stats looking at obesity and diabetes and, smoking rates. And there's really not that much difference between us, but we live 7 years longer.
No biosex differences.
There are some differences, but they're minimal by comparison.
Living longer?
Yeah, so both men and women live longer on average. Australian women live a little longer than Australian men, and same in the US, but really the gap is very similar. Also, you might think is a little facetious because 7 years is bigger. Before COVID, obviously, the difference was about 4 years. And COVID took a massive hit to life expectancy in Americans, which was super sad. And hopefully we can start to recover that. But I think that what I came down to is what's the difference, and it's the way that we provide healthcare. And there's a massive difference between the way we provide healthcare in Australia versus the way we provide healthcare in America. You can look at it in so many different ways. What's the accessibility for people to actually get in and receive preventive services.
Can I ask you a question on that? So in the US, you go in and you're pre-diabetic, come back when you're a diabetic. There's no prevention. Is it the case that in Australia they're actively trying to prevent? Because that would be the reason right there that the life expectancy is, longer in Australia versus America, because we don't really do preventative care.
To answer the question simply, yes. I think that's obviously this is a massive topic and it's very nuanced. However, we have a very robust network of primary care providers back in Australia, general practitioners, we call them GPs. And in fact, a lot of doctors who go into training, they will spend their time in hospitals doing postgraduate training, and they don't end up becoming specialists. They'll go down and become a GP. And then going out in the community and working in a GP clinic. So everyone who, when you turn 40, you get a screening evaluation for all of those things: elevated blood pressure, diabetes, hypercholesterolemia. Say you get diagnosed with prediabetes or diabetes, then you can get put on a diabetes or chronic disease management plan, which is funded by the publicly available Medicare. It's been a little while since I've worked in that system, so I don't know exactly what they're doing right now, but at least back when I was working there, that chronic management plan would include, doctor's visits, it would include dietitian consultations, it would include a visit with exercise physiologists.
So you're actually getting educated.
Yeah, exactly.
And you start to understand your glucose response. Do you get a CGM? Does it go that far?
I don't think it's quite to that stage just yet. But once you have the evidence that can support that that's something that would be helpful, then sure, there's lots of different mechanisms you can put in place to help people. But I think the bottom line is that you're not leaving people out in the cold, where it's like, the other day I had a patient who I saw, a 40-year-old guy, came in because he had an abscess on his leg because he's got diabetes. He doesn't have pre-diabetes, he's got diabetes right now. Normal range of blood sugar is 70 to 100, let's say. His sugar was 440. Yeah, when he came into the department, and he had been fasting for 8 hours. And I was like, hey, so tell me about your diabetes. And he's like, oh, well, I have.
So his fasting blood sugar
was 440.
Was 440.
Yeah. And he was just living his life.
I just didn't even know that was actually possible.
100%. See it all the time. He's 40 years old. He's got 3 young kids, So I was like, tell me about your blood sugar. And he's like, well, my doctor's been sort of telling me that I've got pre-diabetes and been threatening me with diabetes. I'm like, well, sir, you have fasting sugar of 440. You have diabetes. And I was like, so what's the plan? Tell me about when your next primary care appointment is, when are you going to go see them to try and get this under control? And he said, well, I just moved from out of state, and my first appointment to establish care is in June of 2025.
You just can't get in.
Can't get in. And we're in October now of 24. So it's 9 months down the track, he's waiting to establish care with literally a time bomb in his body.
What are the complications that could ensue?
He was there with an abscess, right? So you have a sugar-rich environment. Yeah. So that sugar is not just in his blood, it's in every tissue in his body. So, not unlike other people that I see get a soundbite from me. I interacted with this gentleman for 30, 40 minutes in the emergency department, and he was worried. He was scared. And he just needed help.
So you treat the abscess, but you're not treating the root cause here.
I'm doing my best to talk to him about dietary interventions and trying to figure out what it is that, is driving him to eat and all these sorts of things. We find lots of different things. We found out that he's a traveling guy, a traveling salesman, essentially, convenience foods, fast foods.
Eating in the car, on the plane,
those are the sorts of things that in order to make meaningful change, you need to have a regular sit down with someone who can be there as a support person. And let's say transplant that guy into Australia. My hope and again, I'm not up to date on like the waiting times for primary care providers and GPs in Australia, but the hope is that that person would be linked in, get a chronic disease management plan. They can have a meeting with a dietitian, because GPs are amazing. Like here and in Australia, they're amazing. They have so much knowledge on healthcare and how to prevent disease, but they're not the be all and end all. As I said, this is a team game, so you've got dietitians, you've got, you've got your nutritionists, you've got your diabetes educators, you have your psychologists, you have your exercise physiologists who can come in and they can provide an additional pillar to help someone with their healthcare.
How many full-blown diabetics do you have in Australia? Do you know what the percentage is relative to the US?
Yeah, I was looking at that as well. So it depends, right? So you've got lots of different types of diabetes, but basically you've got double the amount of people who live with a diagnosis of some form of diabetes in the US compared to Australia.
I guess maybe lifestyle, if we break it down to type 1, type 2, that's maybe a better lens into, I guess I'm just trying to get at this prevention piece. Would the gentleman who you saw in the emergency room with the abscess, would that have even happened in Australia?
That's a good question. It's possible, no. Yeah. When you move states here, it is very hard to reestablish care with someone. Plus, there's like a mentality shift as well, right? So people know that when they come to see and interact with the healthcare system, it's going to cost them money, regardless of whether they have insurance or not. Even if you have the best insurance in the world, if you go to the emergency department, more than likely there's going to be some sort of a copay, especially if you're young, right? You haven't met your deductible for the year, so therefore you're going to have to pay. People don't have that. Like, they just don't have, whatever it costs, a couple $100 to to get healthcare. So people sometimes in America have an aversion to actually interacting with the healthcare system because they're worried about the cost. Whereas that piece is taken away in Australia because of Medicare and the fact that we have a system that is single payer. So people can attend, if they don't have a primary doctor, they can attend the emergency department. They can get started on a journey to improve their health, and then know that, my instinct was correct. I need to have a GP here, and I need to, establish with someone so that I can, have the care that I need ongoing. People even, like something that I talked about in my TED talk is something that boils my blood when I see people, is that like for the first 3 months of every year, I'll get a very similar story where it's like, hey, I need a refill on this medication. Oh, why don't you go to your primary doctor? Well, my employer changed my insurance company and my doctor is now not in network for that insurance company. For someone like that gentleman I'm talking about, he needs that service, and he needs the help. And yet we're just like letting him swim out in the open by himself.
Yeah.
And then it's hard as well because I'm like, okay, well, you don't have a provider. You're welcome to come back. You're welcome to come back here and see us anytime you want. But if he has a bill, or he knows that he's going to have a bill, how likely is he going to want to come back just to have another conversation with me about, well, let's check it today. Is it 440 or is it 380? It's just very challenging for folks. And I think that if we want in this country to have better outcomes for a lot of that stuff, we do need to think about spending our money, not when disease risk is already accumulated, but spending it wisely before it presents.
Yeah. And I think that's why we see a lot of these functional medicine clinics popping up, in the US and becoming really popular, because they're getting at the root cause of things. We've got to level up in some ways, modern healthcare does.
We have a chance and we have a future. And like I was with some of my Aussie buddies like about a month ago now, and he was like, oh man, what's it like, living in the US? Like you have the smartest people there, you have all these Ivy League universities, and like there's just an assortment of incredibly smart people. That must be amazing to be around. And it's true. Like we have some incredible people. We have incredible innovators. Everyone's at risk of like falling into this like track and just like doing what they do, and not like thinking to ask questions of like, well, is the status quo exactly what we want? And I think that this is the double-edged sword of somewhere like America, is that yes, you can get into those entrenched sort of values and systems, but you also like innovation is valued, and we can do a lot. And to that end, where I talked about, I guess I had a call to action in my TED talk, and part of that was that people can support things like direct primary care. It's essentially a stripped back version of the current primary care that we have, whereby docs They're sick of having to do pre-approvals and don't want dealing with insurance companies. So they basically take themselves and a nurse, and they do everything. They take the blood, they book people in for the next appointments, and they can spend 40, 45 minutes with a patient. And that is so much more rewarding for the provider and for the patient. And it allows the provider to provide healthcare that's less expensive and is what the person wants and needs. That's not the be all and end all for solving healthcare, but it's a step, in the right direction. And I think the more that people sort of explore this and, why it costs so much to provide healthcare in the US, the more they can support things like this that sort of strip away those unnecessary entities that are contributing to the cost.
So you've been, kind of in the high performance space for a long time. So presumably you working with, some motivated folks. What about, the folks who end up sick, the guy with the abscess, for example, a lot of it is, I see kind of two problems or two tensions. One is the individual doesn't know how to apply their effort. So there's just a lack of education or understanding. If we put that aside for a second and say, okay, I know what I need to be doing, but I don't do it. What is your take on how do you solve that for an individual? And I know that is $1 million question, right? But you're with humans all the time, right?
Yeah, for sure. I like to use smoking for this example because, believe it or not, people still smoke.
I know, it's crazy, right?
It is. It blows my mind that people still smoke.
I just talked to a pulmonologist, and yeah, he was saying that, yeah, smoking. I'm like, oh, people still smoke, but yeah, they do still smoke.
Yeah. So it's 11%. So it's significantly less than it was.
Yeah.
Which is great. But the thing that I like to do when I'm talking to people, and don't forget, I have pressure to move people through my department when they come to see me. So I have very little time to talk with them. But I think that also feeds into part of the answer to your question is that having these repeat exposures to these ideas again and again and again is really, really important. And focusing on dollars, not cents. I think what so many people do is that they'll step over dollars and pick up cents. That's a line that I got from one of my countrymen by the name of Simon Hill. He's a podcast.
I interviewed Simon on this. Yeah, he's tremendous. Yeah, so knowledgeable.
Oh, it's amazing. But I think that for example, smoking is $1 that people can easily pick up. Whereas getting optimal sleep might be an example of a cent that they shouldn't try to pick up until they pick up the $1. So, asking a simple question like, hey, what do you like about smoking? And oftentimes they say, well, I'm addicted to nicotine, so I like how it makes me feel. And when I don't have a cigarette, I don't like the way that I feel. Okay, well, did you know that there are products out there that actually replace nicotine without exposing you to all the other risks and chemicals, tar and things like that are in cigarettes, and all the damage that the smoke does to your lungs? Or it might be something super simple, which people don't probably realize. I really enjoy having a cigarette when I go out on my front porch with my cup of coffee. It's cold out. I have my warm coffee and I smoke a cigarette. And then that's something that's even harder to replace for them, right? Then you flip it on them and say, well, what is it that you don't like about it? What are some things that, if you didn't have smoking in your life, you'd be able to do better? And they'll be like, well, I'd be able to play with my grandkids more. I get puffed out because when I I've been doing a pillow fight with the kids for, 2 minutes or whatever. This whole concept is called motivational interviewing, which again, GPs, primary care providers they get trained at doing this and they're really good at it when they have time. I have no time. So it's really hard for me to do these things in the emergency department, but I still do it because I think it's really, really important. When I ran my sports performance business back home in Australia, my mentor then, he said, some people need to be exposed to the same thing 6-7 times before they actually take action. So my take on it is that we continue to tell people what the dollars are, and then continue to tell them how to pick them up, because it might take that person 6, 7, 8, 9 times of hearing the same thing again before they actually, something clicks in their mind and yep, I'm going to do that today. It's a little easier for me in the emergency department because I can connect it with something really bad that's going on for them right now. So they have this visceral memory of what it was that happened to them because of some lifestyle choices that they made that maybe were not optimal.
Yeah, that's a really nice framework. So you spent a lot of time doing this big comparative analysis. We spent some time talking about diabetes, what are some of the other behaviors that you see Australians maybe engaging in less? If we were to look at the big dollars, right, that really move around our health. So like, alcohol, smoking. What are some of the behaviors that you see maybe Americans doing more of and Australians doing less of? And maybe there aren't any difference and there's something else, that in maybe it does purely lie in just healthcare being more educational and preventative minded. Is there anything else at play that you see culturally?
Not to be facetious, that is a big part of it. I think being able to be outdoors for basically the whole year around, that makes a massive difference. So, events and social events that people engage in, fun runs and all those sorts of things, they happen all the way throughout the year. So that gives people like some goals to work towards. So honestly, I didn't look into physical activity rates, but I intuitively, I would say that probably Australians are a little more physically active.
I have a theory around that.
You do? Okay.
I do, yeah. Club sports.
Yeah, for sure.
I think the club infrastructure in Australia, I played field hockey for the US team, and we trained in Australia a ton, and Australian, your field hockey team is sensational. I played during Rick Charlesworth's reign. I don't know if you know him, and Terry Walsh, who center forward for the Australian men's national team for, I think, 3 Olympics. He was one of our coaches for the US team. Love all things Australian field hockey. They were so damn good. But one of the things that I observed when I was there is just how I think established the club infrastructure is, and it's basically like, just every district, I guess, has their own club where they have field hockey and basketball and cricket and there's tons of sports, and everyone just descends in the area, belongs to the club, descends on it, and just play sports all day. Is that a fair characterization?
Yeah, there's definitely a big
that has
culture
to do
of that.
something. We just don't have that. Adults stop playing sports after college. Generally, you might do a game of pickup basketball or something, but there's no kind of established infrastructure where adults can continue to play sports.
Adding to that is like the social aspect that you get from that, and
connection.
Yeah, there's a lot of people who've been talking, especially today at TEDx, have been talking about, the social connectivity of and how important that is in terms of, remaining, connected to people and how that affects your lifespan. Back to the weather piece, I think that there is this like huge percentage of the population, they go underground during winter, and just it's
and the behaviors that come with that are, we're watching a lot of TV, or eating a lot of food. Not getting exposed to temperatures and
totally, and then there's this whole concept of like food and the way that people eat, and how we have a few cultural events such as Thanksgiving where we just gorge on massive amounts of calories. And that's not to say we don't do that in Australia. There is certainly, Christmas Day is the equivalent of that.
It's a Barbie though. It's around the protein.
Well, and also around
not
like,
the
I
not
think
the pie.
seafood's a big part of it as well.
Yeah.
So like just thinking about like animal protein and the type of food that you eat, there's those pieces. So whilst there's a lot of similarities, there are some differences. I think that also when people do go off track for whatever reason, they lose their job, they are coming from another country, immigrating from another country, as permanent residents. My wife was a permanent resident. Our son was in the NICU for his delivery for 4 or 5 days. She had access to lactation consultant afterwards. She had a midwife come out to the home for the first couple of days after delivery. As a permanent resident, she got access to all of that for free. There's this large safety net that I think protects us from the own bad habits that we have as Australians, but the proof is in the pudding. We on average, women live longer than Americans. So, I think there's something very profound to be said for how effective, supporting people, particularly when they're vulnerable, can be to help them live longer and happier lives.
Do you observe light behavior in Australia being better perhaps than what we find here in the US? We spend about 93% of our time indoors, right? So we're not really connected to the primal thresholds of nature. And, just kind of back to our point about Australia, Aussies kind of having the opportunity to be outside because it's so, the temperature is so favorable. And do we have any data around how much time Australians are spending inside versus Americans?
So in terms of data, we have some of the highest rates of skin cancer anywhere in the world. From that perspective, like that in and of itself is a pretty telling statistic that we get plenty of light exposure. We obviously have to be smarter about when you do it and applying, a decent sun cream and things like that. But I think that's a pretty telling stat. Which, is that a part of that, a part of what helps us live longer and live with marginally lower rates of these non-communicable diseases? Maybe.
Yeah, I mean, vitamin D is really from the sun. It's so powerful, on our immune function. And so, yeah, it's fun kind of putting the puzzle together here. What do you feel like, uh, Americans can learn, if you're kind of to think about it really tactically, from a behavioral standpoint. You've been inside the world of strength and conditioning for a really long time as a strength coach. And are there things that we're missing here that would be really helpful for us to think more broadly about?
I think I've talked about it quite a lot, whereby this whole concept of dollars and cents, only because it just makes a lot of it is a very poignant example. But we in the US, I think there's a massive push for people to try to find out what those 1%ers are. How many of the 330 million people actually need those 1%ers? I think it's probably a lot less. I think that people, need support to be able to do the simple things correctly. So not smoking, how can we help that mom who is like 2 or 3 jobs to get by, who just goes to the local KFC because they have a meal for 4 for $12 available? How can we help her be able to access
healthier options
that are within a price range? So then that way we're getting a larger percentage of our population who are able to, do those simple things really well. So then that way we can really, use the innovators that we have in this country to like then switch mode to like really get down on the 1%ers and be able to help folks, with those 1%ers, which then is going to really will take us to a whole new level in terms of how we live our lives and how long we live. So
yeah, because I suppose, without the foundation, layering that on top of a really cracky foundation is not going to really have the kind of effect.
Totally. But then people who don't have those, that foundation in place feel pressure to like reach for these other things that they're not, they're going to help, but if you're still smoking or you're still like having like 80% of your calories come from highly processed, hyper palatable foods, what additional benefit are you going to actually give yourself when you've got this huge pillar you can put in place that's going to exponentially improve your health span?
What else do you see as the big pillars?
Yes, I mean, like the big ones would be like diet, exercise, not smoking, and I think on those fronts, it's kind of supports a fourth, which would be social connection and acknowledging culture that you have. And that can be culture that you have as an immigrant. That can be the culture that you have as, an American family living in Boston. That can be the culture you have as, a college athlete, So how can you like exercise in a way that, that acknowledges your specific needs and your specific culture? How can you eat in a way that acknowledges your, culture, as well as help improve your social connection with the people around you, and how can you undertake your lifestyle in a way that is meaningful to you? Like those probably 4 things I think are really important. So what did I say? I said diet, exercise, social connection.
Yeah.
3 things. Yeah. I think those are the 3 things that I see people skipping over the most when they come to me in the emergency department.
I'm surprised you didn't say sleep.
Oh gosh, don't get me started on sleep.
Okay, well, I wondered, as a emergency care physician, are you, do you work nights? I do. A lot of my research is on shift workers. We just wrapped up a really big study with Stanford Medical. I did a study with University of California, San Francisco, and Las Palmas. So lots of shift work data. And when I look at the physiology, we did one with acute care surgeons too, Denver Health, 270 in that sample. And the average age in that study was 43. Their resting physiology was that of a 60-year-old.
Wow.
Yeah. And, when you look at, the amount of nights on call, we have a shortage of acute care surgeons here in the US, as you probably are very much aware. So the roster size for those folks is pretty small. So they're doing a lot of on call. They're going in a lot. And, we see basically a direct correlation between how many times folks go on call and the Maslick burnout inventory scale. So we see MBI and number of times on call kind of move in the same direction, unfortunately. So I'm just curious your thoughts on just shift work and sleep and
Yeah, I mean, it takes years off of our life working as a shift worker. I mean, I say it all the time to my wife. I'm like, hey, I need to work on my sleep hygiene because there is no way around me not being able to. I have to work overnight. Probably the best way to switching back and forth between days and nights would be to just work all nights, and switch my circadian rhythm completely.
No question. Yes.
But I don't want to do that because I got an 8 and a 6-year-old and I want to be around and go to their sports and, go and help volunteer in their class and things like that. So yeah, sleep is super important from that perspective. And I'm acutely aware of that. I think that it's not just people in the medical field, right? There's people that are working in warehouses doing packing overnight. There's so many people out there that are working shift work where they have to be switching back and forward between them.
When you think about just the definition of a shift worker, that we use in circadian science, I mean, it's basically if you're awake between the hours of 10 p.m. and 4 a.m. for 2 hours per week for 25 weeks of the year, you basically qualify as a card-carrying shift worker.
Yeah,
so, I mean, that is, and you think about 10 p.m. and 4 a.m., I mean, that's everyone, right? There's a lot of folks, right, who quote qualify.
There's a massive hole for those folks in terms of you need to better understand how this is going to affect your body. I hadn't heard that resting physiology piece for these folks. That's crazy to me.
I know. So we have the benefit of being able to do an age match cohort, and we have healthy user bias on the Whoop platform, to be really clear. But basically what we did is, we have our acute care surgeon population wearing Whoop for the entire duration of the study. So we have 2 years of data on these folks. So we look at their resting physiology and then we do an age match cohort. So a perfect match of those 270, perfect match. And what we see is that their resting physiology looks like 60-year-olds on our platform.
Yeah. Blows my mind.
Isn't that just wild?
It kind of gives me a little bit of anxiety to think about right now.
It's one of those things where it's I have all these data, right? And it's hard not to sound so ominous, but it really is a call. That's a call to action too, is how do we give folks like yourself more resources, And, when I think about the global population and global, just the health of our population, I really think about this, our interaction with light as being kind of so foundational to kind of health and longevity. And we're getting our light behavior wrong. A majority of folks are. And I don't know that folks are really aware of the significance of what's happening and how that might be a reason for some of these diseases and illnesses that folks find themselves with.
Yeah, and I think the key here though is to talk about it.
Yeah.
And to I guess
try
hopefully
to give strategies and
for sure. Yeah. What this actually
pay
happens.
down the risk. Yeah.
People would be like, I don't even know that this is a risk for
I know.
me.
I know.
As a first step, helping them understand that. Then 2 is say, well, actually, you know what, this is something that you can do to try and help improve that.
Exactly. And we're trying to do a lot of that research too, is, when they exercise 2 times a week and 3 times a week, does that pay down the risk? Do they have better resting physiology? So we're looking at the data in all these directions, and there's no surprise. The more you exercise, the better off you are, right? You can mitigate some of the effects of being up during the night. Just even timing of when people eat as well. Just doing it during, the daylight hours when, at the end of your shift, before your shift, when the sun's still up, getting a bulk of your calories in also seems to be a really helpful dietary strategy for shift workers. So there's things that we can do,
Yeah. Yeah, for sure. And then I think being able to make that in an accessible way for people is super important because, we talk about wellness and burnout and all of those sorts of things. And like these things contribute to it. If you are like, what it's like working. Well, when you're working in a hospital, there's always donuts out. There is always like candy out. Like it's so easy to just walk past that drawer and like pull out some candy from there, So, and it's the same for all of these workplaces. You see people come in and they've got these 22-ounce, specialty coffees that are laden with sugar and all of this sort of stuff. And it's just, and I get it because it's a convenience food, right? I'm driving to work and it's 11 o'clock at night and that's the only thing that's open. So I'm just going to stop in there on my way to work. So, but, helping people to better understand those things is really important and trying to help them. But you need people there that are able to help them, so, and give them that information.
Yeah. What's the message that you want to get out into the world?
Oh my gosh. I think the goal is it's never too late or it's never too early to start.
I love that.
Yeah, it's never too early to start and it's never too late to start. It doesn't matter. Like if you're 50 years old and you've been smoking for 20 years, you can stop today, and in 7 years' time, you will have reversed much of the damage that you've had to your lungs, and you can continue to go on and further reduce your risk by putting in multiple other practices like better dietary approaches, maybe starting some medications to help manage all the other risk factors you have for cardiovascular disease. But it's important that you start early and better understand, what it is that you need to do. People know what they need to do. Like, I can't tell you the amount of times where I will foreshadow to people that I'm going to get on my soapbox and talk to them about what interventions they can do to improve their health.
Yeah.
And they'll rattle off to me before I even start what they need to do.
I know.
So people know what they need to do. It's just that we need to make it, I don't know, almost make it cool to do that. As a group, as a society, is we need to encourage people to make different choices that are going to be better for them. Because if we do, we have more people in our community that are healthier. Then we're going to just have a better community and a better society because people are healthier.
I see that shift happening with alcohol.
Yeah, for sure.
Do you see that too?
Yeah, like culturally.
I might be in just an echo chamber, but
I think there certainly are echo chambers, but I think you see all these companies coming out that are like non-alcoholic, beer or whatever it is. Like I see a lot of people that are making that choice now, and I'm sure there's certain times in your life. I certainly did partake myself where drinking alcohol is part of the culture that you have in that moment. But I think that there are shifts to move away from that. I'm positive about Gen Zers now. I'm positive about their group. I think that they're going to change a lot about the way we do things.
Yeah, I completely agree. I mean, my son is kind of a good example. Like, he and his friends are all like wearing Whoop, and it's like getting cool in their school to like be optimizing for sleep and recovery and like working out and kind of talking about the data. And it's been like really neat to witness, that there is just this, I guess, acceptance too of just the data and the truth that kind of comes along with that, and just being more objective, I guess, about the things that move around capacity and performance levels. And yeah, it's kind of it's cool to see that shift.
I think also we need more people that are able to communicate science to more people.
Yeah.
There's so many people, you can rattle off all of the names of people that are doing really well in this space at the moment. But this is partly why I wanted to do TEDx, is I wanted to be able to like put together a 10-minute talk where I can get across the information that I want to get across in a meaningful way. So I think that's a really important piece that needs to be added. We need to encourage people who are doing science in these areas, in these like specialty areas, to be able to be better communicators so that they can get these messages across to people in a way that's meaningful to them.
Yeah, I love that. It's a hard skill, and especially when you're doing the research and writing manuscripts and going through the peer review process, it's very time consuming. So scientists are doing science, and it could be hard, to
boring too. It's not interesting. I've written so many papers that have like never got accepted, because they didn't like they didn't have the right wording. They didn't like explain the methods in the way that,
Oh,
the
interesting.
journal wants.
Yeah, yeah.
But that's the way it goes, right?
Yeah.
That's what makes peer review science rigorous, because it can be reproducible, but it's boring, So being able to like take folks who do that research and then be able to like educate them or encourage them, empower them to like communicate it.
What does no good if that research sitting on a shelf somewhere? It's like
Exactly. Exactly.
if it's gonna help people, we need to get it out there, So I do think there's energy around that too, with folks like Dr. Huberman and, like there's some really amazing scientists out there who are super effective at communicating science and putting it in very actionable terms. So there's a lot of good templates and, that I think scientists can use, to be like, all right, I need to figure this out. I need to figure out how to do this,
For sure. For sure.
Yeah. Well, it's been really wonderful to talk to you.
Thanks very much for having me.
Is there any other final thoughts you want to leave with our listeners?
No, I'm very excited to be here, and I hope that in some small way, things that I've had to say today will spark some kind of energy in someone to make a change in their life that will help increase their health span.
I love that. Thank you so much.
No worries. Thank you.